a lot of people think that when they do genetic testing, it just means that they're going to find out they're doomed to have a condition. And so they have a lot of anxiety. And a lot of people will say, I'm not going to change anything, so why would I want to know? We always talk about mental health and where the patient's at in life. Like, I'm never going to force someone to know this information. But I also like to say that there's a lot more you can do about it than people think. And so I always try to make sure people leave feeling empowered and not feeling like they have this big risk that they can't avoid. In my experience, a lot of patients have flipped to being scared initially, and then finding out the information actually makes them feel empowered to actually feel the opposite of doomed. Like, they actually have the information, they have the awareness, and they have a plan on what to do about it.
Women need to empower women, and our voice matters.
Bitch.
Welcome to the Mom Bitch Podcast.
Welcome everyone to another episode of the Mom Bitch Podcast. We have an amazing episode planned for you where we're going to get into the nitty gritty, dive deep into the jungle of genetics. We're going to talk about why you need genetic testing, what it is, why not to be scared of it. We're going to answer all your questions here today and hopefully get you some answers. And we are joined by the fabulous Natalie Sampson. She is the owner of Golden Genetics, and she's going to give us the 411 into everything we need to know. So thank you for being with us today.
Awesome. Thank you so much for having me. I'm excited.
All right, let's just start with what it is. What is genetic counseling or testing, and why do we need it?
Yeah. Okay. So I think a lot of people don't know what genetic counselors are. So genetic counselors are actually trained healthcare professionals in the medical space to help individuals understand their genetics and help them apply that knowledge to their life. And so a lot of people just don't know this exists. Genetic counseling in general is a pretty small field. Like, a lot of class sizes are only 10 people. So it's expanding right now and it's growing. It's been around for a while, but originally it started off as genetic counseling, just helping patients who are pregnant for prenatal. So we've just expanded into a lot of different specialties. So genetic counseling in essence is actually that trained genetic counselor professional working with an individual to understand their genetics, apply that knowledge. And also the third piece of it is to help support them through understanding that. So we are trained in psychology because genetics can be, like you mentioned, scary to some and confusing and can have a lot of implications, especially in different specialties. And so we're trained to help interpret this knowledge and then also kind of be that support system for that patient as well. And so that's just genetic counseling. And then genetic testing is kind of its own world.
Can you talk a little bit about why is it beneficial? Why is it something that we should be, looking for doing for ourselves?
Yeah. Okay. So I wasn't sure if I wanted to jump into the genetic testing world, if you were ready for that.
Yeah.
But it kind of meshes into,
yeah.
You're ready. Okay. So in genetic counseling, we're trained actually in a lot of different specialties. So there's preconception, which means genetic testing before you even consider having a family. There's prenatal, which is you're currently pregnant and you're doing testing for dad and mom or for the baby. Future baby. Then there's pediatrics, which is like children, testing for children. Mostly pediatric encompasses genetic conditions or things like, autism fit all into that category. And then there's adult. And so adult is, a huge variety too. But in general, what I focus on, so my specialties are adult genetic testing, and we focus on predispositions for Alzheimer's or dementia, heart disease, and also cancer. And then I also focus on nutrigenomics. And so nutrigenomics is kind of its whole other test realm, but you can actually usually use that information on both kids and adults. And so the reason I brought all that up is because it varies on why you'd come see us based on the different specialty and what you're needing. We also have a genetic counselor in our practice who does specialize in pediatrics, autism, connective tissue disorders, and preconception testing, like carrier screening. But in general, when someone has a family history of certain conditions and diseases, there's kind of two areas. So one is we like to understand your risk because there are things you can do about that risk. And so the earlier we know, the better. Obviously, we talk with the patient about this because, like you said, a lot of people are worried to know this information, which I completely understand. And so I'll work with the patient to make sure that, they're feeling good about wanting to know that information and feeling good about what there is they can do about it, because cancer is different than Alzheimer's, for instance. Cancer, we have screening tools, and we know that cancer caught early is a much better outcome. And so if we know you're at increased risk and we recommend, earlier mammograms or breast MRIs, that could actually save a life. And so we know that that's really important information. Alzheimer's is a little different. There's a lot of research going on about it, but there's not, tools similar to cancer where we know we can be preventative and proactive. So we'll talk about all of those differences as well. But in general, if someone has a family history of those conditions, or they just want to be proactive and preventative, that's kind of one reason people would want to do genetic testing for those specialties. And then the nutrigenomic side of things is, how can you use your genetic information to optimize what you're currently doing with lifestyle, diet, and potentially supplementation? So I usually try to test patients for both of those and combine them to really help the patient understand their genetics and apply that fully. But I would say, there's a whole host of other reasons, obviously, to consider genetic testing, but those are some of the top reasons I talk about with patients and why they may want to see me.
I just have a question. It's kind of off topic, but I've heard of genetic testing, obviously, but I've never heard of nutrigenomics. What exactly is nutrigenomics?
Okay, that's such a hard question to answer, and one I get all the time, because the reason it's hard is because it's almost like we have all this technology and we have ways to look at genes, but we haven't really defined how to differentiate all of it. And so nutrigenomics in essence is really understanding how we process and metabolize nutrients and how nutrients interacts with our genes. But the way that nutrigenomics has expanded is now it's much more than just nutrients. It's also things like, can your body detoxify a certain chemical? Or are you at increased risk for high cholesterol? Or, what activities may be better for your body, given the fact that we know genes can relate to slow twitch and fast twitch muscle composition. And so it's kind of expanded into a lot more than just food related. So the test that I use specifically looks at a lot of different genes associated with a lot of different areas. But in general, the main differentiation I would say is that when we're looking at nutrigenomics genes, it's not like we're going to find one gene and we're going to see that there's a harmful change, which we call a mutation in that gene, and be able to give you a diagnosis of something, or be able to, we won't even recommend screening and surgeries. We will say, though, you can change lifestyle, diet to optimize your genes with this knowledge. But when we're doing traditional genetic testing, I like to call it, which is more looking at predispositions on high impact genes, that's when we're going to be able to pull data for, more clinically actionable is what, it's kind of defined as. So I like to combine both because I think both are important.
That's good. So it's basically kind of how to optimize your everyday kind of health things that you do, like you work out, what you're eating, kind of.
Yeah.
Yeah.
Mm-hmm.
Okay.
Totally.
Very cool.
Mom bitches, you guys know I don't know diddly squat about science or medicine. So you got plain old Jane mama over here. But, you hear a lot of, well, you're preconditioned to have XYZ because of your family history. And that may be the case, that may not be the case. So this testing, how much of my family history do I need to know? Or is it just solely based on the genetic testing that you do that you can tell me, hey?
Mm-hmm. Yeah, that's such a good question. So interestingly, when we're thinking of inheritance, meaning how genes are passed down in generation, each person has 2 copies of each of their genes. And so mom passes 1 copy down and dad passes 1 copy down. And so the combination that you get for mom and dad is going to be really different than mom and dad's genetic makeup. And so your genetic makeup is going to be different. So that's just something I like to talk about, because what that means is that even if you have family history of a certain condition, it actually doesn't mean that you inherited that risk. It could mean that you actually didn't. And so that's one reason we actually like to do testing, because a lot of people say like, you know, my mom had breast cancer. I know I'm going to get breast cancer. I'm doing early screenings, but that's not always the case, that we can actually rule out that maybe you didn't inherit that risk, especially if your mom tests, she knows she has a genetic mutation and then you don't, then we know actually it didn't get passed down to you. And so with that being said, you actually don't need to know your family history to do the test. And it's helpful, and I'll tell you why, but you don't need to, because we're actually still going to look at your genetic makeup, what you were born with, the genetic composition that you have uniquely. And so we'll see patients who are adopted a lot, you know, because they don't know and they actually want to know that information if they need to be aware. But the reason that we take family history and that genetic counselors love pedigrees, which is basically creating a family tree, a medical family tree, is because we can look to see if something comes up in your genes, we can look to see how it's being passed down in your family. So what inheritance pattern it may be following, which can be helpful for, one, understanding if other family members in your family want to do testing, but also two, if you're at risk of passing this down to children yourself. And then also just understanding which side of the family it came from. Because again, we can't really know unless we test both parents. But, you know, if there's a strong family history of cancer on mom's side, then we can probably conclude if you have an increased risk that it came from mom's side. So those are some of the reasons we like to have family history, but it's not really necessary. And we can still pull a lot of information, even if you know nothing about your family history.
I have one more question. So, and this is more of a personal question, but I'm sure many women run into this. So, you know, to that point, right? Like, I am a middle-aged woman, like she, her. That sounded weird. Anyways, and when I was pregnant, I got gestational diabetes. And then after pregnancy, I got postpartum preeclampsia, which they're not sure why women get that. But those two combined, especially, they told me can put me for a higher risk of heart disease, type 2 diabetes, etc. in the future. So with that said, my next question is, would my genetic testing before a baby potentially be different than genetic testing after a baby based on things that my body has gone through?
Short answer is no, because our DNA doesn't change in our lifetime. And so the genetic code is what we're actually looking for when we're doing genetic testing. And so when we do this test, it's a one-time test, pretty much. I mean, you can do update testing, meaning we look at other genes that weren't tested for originally or use different technology. But overall, the genetic code itself shouldn't change from, you know, if we did it when you're 1 year old to however long. But what does change is epigenetics. And so epigenetics is this idea that, or epi means like on or above. And so epigenetics is how the genes are turned on or off, meaning genetic expression. And so our genes are flipped on and off all the time. And genes are basically instructions for our bodies to create or do something. So like we have a gene for everything in our bodies. We have genes for hormones. You know, we have genes during development that turn on and then shut off later. And so the study of epigenetics is a really important piece to understand how these are playing out in our body. So we have some control over how our genes are turned on and off, and some things can impact whether our genes will be turned on or off. Other times, that's not always the case. So like if you have a genetic variant for cystic fibrosis, you're not going to be able to like turn that off. You will have cystic fibrosis. Or, you know, if someone has Down syndrome, they can't turn on or off that gene or that chromosome. But in general, a lot of genes can be switched on or off. And that's kind of where we talk about nutrition and lifestyle being preventative for certain diseases. So like type 2 diabetes, for instance, you can basically turn on or off certain genes that relate to blood sugar spikes and drops, right? And so if you have constant blood sugar spikes and drops, that can give you an increased risk for diabetes. And we can see in nutrigenomics if you're at increased risk for those spikes and drops. And so by maintaining, protein, healthy fat, and fiber in your meals, you're epigenetically turning on or off those genes. And so that's kind of where we have some control. And so you'll hear a lot of, the phrase genetics loads the gun, environment pulls the trigger. That is literally referring to epigenetics, which is this idea that we can control expression, which again, I like to caveat is not always the case with all conditions, but we'll talk about that in my practice. I always like to say that, this is what we do know. We can upregulate or downregulate this gene or these genes that relate to each other. And so it's kind of like a puzzle.
Yeah, it's a great explanation.
All right. So how does your practice we talked a little bit about like traditional medicine, and then how does your practice of genetic testing fit in with that?
Most genetic counselors are in when they're in direct to consumer, which basically means when they're seeing patients, they're normally in hospital settings or, healthcare institutions. So I was doing that as well. I worked at a hospital in oncology and neurology. And what we do is we talk about, the genetic testing, the genetic test results, similar things that I referred to already. But a lot of times what's discussed is what you can do about it from the perspective of a very traditional space. So screening and surgeries, we talk about often if applicable. And that's kind of where that conversation ends in terms of risk management. And so what I've tried to do in my practice is take an integrative approach, which means using, traditional medicine and the best of Western medicine, but also combining it with understanding that we need to approach the person from a holistic space. And that includes when we're doing genetic testing, because we know in research, nutrition, lifestyle, sometimes supplementation impact disease risk a lot. And so when I was at the hospital, it was confusing to me that we were talking about surgeries to lower risk. And patients would ask me, okay, so is it okay that I'm eating McDonald's every day? And, it's like, we didn't talk about how we know certain diets can reduce cancer risk or increase it. And so what I tried to do in my practice is bring that integrative approach, bring nutrigenomics in, bring this understanding that we can use both worlds with the combination of genetics to personalize a plan and also allow you to really be proactive and preventative holistically. Because I just thought it was such a missing piece. So
absolutely,
I would say that's kind of the difference here.
Yeah. And you said that genetics is just one test. So you test for the specific genes, right? Obviously you can do more tests based on, other genes, but you get the test results and then you counsel the patient. How long is the counseling period?
Yeah. So also side note on that, there actually are a lot of different types of genetic tests. So we can pick and choose which one would work best for you based on your goals, your personal history. And I guess that's another reason it can sometimes be beneficial to do family history. We can also do broader tests that encompass a lot of different things. But in general, and also I just like to side note also that the testing that we're doing is not 23andMe and Ancestry. We're not figuring out, where you're coming from, which is all fun.
Right.
But when we're doing health genetic testing, we use different labs and it's, we want to make sure results are accurate and protected and private. In our practice, we do pre-test counseling, which means I meet with the patient for an hour before we even test, because I like to have the person understand what we're actually doing. I want to walk through with them personal and family history in depth. So I really hear their story, because when we're looking at their genetics, yes, genetics is a huge piece, but also recommendations will vary based on where that person is at. So, this is an extreme example, but if a woman comes to me with a BRCA1 mutation, which increases risk of breast cancer by a lot, it is recommended to discuss the potential of removing their breasts for, proactive preventative care. And so that recommendation I will talk about with someone, and the way that I talk about it with them will differ based on where they're at in life. Because, if a woman's really young and this is really scary and all new to her and her risk is still relatively low, we're going to talk about screening. So anyways, that I like to do that initial consult to kind of get to know them. When the results come back, it depends on the test ordered, but normally I spend another hour with them after I spent time interpreting to review it with them and review protocol and plan. So normally it's, around 2 hours in total directly with the patient, but I also offer a 30-minute check-in for patients, which I just found this is such complex information and there can be a lot of recommendations. So we'll sometimes meet again after that to just review it again and just see how, if they're applying it to their life and how everything's going.
I think that's like an important piece to it because like you said, not everyone knows what they're looking at. And sometimes you'll see something and then what do? You go to Google and then you come back and you're like, wait, I actually have a lot more questions than I thought I did. But I feel like in traditional medicine, the doctors are kind of like, oh yeah, we're just going to order a lab and then you go get it. And then you get your test results on my chart and you're like, I don't know what any of this means. And then you message your sister and she's a doctor and she's like, stop messaging me, go talk to your primary. And then all of a sudden you're like a sore to your whole family. Yeah. I mean, not that I've gone through any of
very
that,
personal.
But also too, I think that it's sometimes worth paying out of pocket if you can afford it so that you have a little bit more of a individualized experience, because especially women and our bodies being so complicated pre, post, during pregnancy, and all of the hormonal and emotional impact you're going through as a new mom in general, I need like a best friend to talk to. I need someone that I can relate to. And just talking to you, I feel like I'm talking to a girlfriend who is extremely smart and educated, more so than just some random doctor that's just pushing me through the process and then billing my insurance.
Totally. Yeah. And how confusing is the whole healthcare system in general?
It's so confusing.
I feel like I worked in it and when I had my own appointments, I still was like, wait, why am I doing this? What's going on? And you can't access your practitioners. I even at the hospital, it was really hard to get access to me. Like my patients would be like, I tried to get access to you. I had 18 people put me on hold. And so I feel like that's such a big part of it. Like you were saying, that's something I'm trying, I've tried to avoid it. And like in my practice, I make it so that there's a chat system so people can chat me and I'll respond the same day or next day, so like you said, I think, it's hard. I understand there's the issue of burnout as well, but I think, being able to also just have the patient as much as we can, have the patient understand what's going on at every step. And genetics is such a complex thing. It's even harder to understand than just screening results. And so I think, like you said, I try my best to make sure that they know what's going on at every step, that they can contact me at any time. And I resonate with your personal experience being a sister who's in healthcare, having family members be like, what's going on?
I mean, I didn't say I did that, did I? No, my sister will literally be like, message your primary. I'm working.
Yeah.
And then I'm like, so does that mean I am okay since you're not telling me to call 911?
Oh my God.
But okay. So before we get into like a success story, do you have like the general misconceptions that people have towards genetic counseling?
Yeah. So I feel like there's a lot of them. One is that a lot of people think that when they do genetic testing, it just means that they're going to find out they're doomed to have a condition. And so they have a lot of anxiety. And a lot of people will say, I'm not going to change anything. So why would I want to know? And I get where they're coming from. Again, like we always talk about mental health where the patient's at in life. Like I'm never going to force someone to know this information. But I also like to say that I think there's a lot more you can do about it than people think. And so I always try to make sure people leave feeling empowered and not feeling like they have this big risk that they can't avoid. Yeah. And so I feel like in my experience, a lot of patients have flipped to being scared initially and then finding out the information actually makes them feel empowered to actually feel the opposite of doomed. Like they actually have the information, they have the awareness, and they have a plan on what to do about it. So I feel like that's something. But I would say another misconception that I'm hearing a lot right now on Instagram is that there's these genes that kind of take I would say like the limelight. They're famous. MTHFR is a gene that's kind of in like all around Instagram right now. And then the BRCA genes, BRCA1 and 2, everyone talks about them. And I just want to make the caveat and say that it's really hard to actually pull all the information we need from one or two genes. So there's kind of this issue that non-genetics experts are offering genetic testing, and their genetic testing encompasses one or two genes like MTHFR, and they're pulling information and giving recommendations from that gene. BRCA1 and 2 is a little different, so I'll talk about that after. But with that, I just like to say that with MTHFR kind of falls into the nutrigenomics category. And so with methylation, I'm not saying it's not important to test for, but we need to test for a lot more genes than just one gene. We cannot make supplement recommendations and make all these recommendations based on one gene. That was kind of an error. Early on, we had this research. It's now been disproved that we need to know other components. And so that's just something I'm hearing a lot about. The BRCA1 and 2 genes, the reason I brought those up is because those are really important. We can pull a lot of data if you have a change in one of those genes, but they're not the only two genes involved in cancer. We now have 79 cancer genes that we can test for associated with multiple cancers. Breast cancers, there's 10 or more that we've identified. And so we want to make sure, I hear all the time, women will say, I've done the breast cancer testing. I don't have anything. I don't need to redo it. And we'll look at their test and their practitioner only ran BRCA1 and 2, and they have strong family history of breast cancer. And I always say, okay, we need to redo another panel. And we end up finding a lot of times that they have a mutation in a different gene that wasn't originally tested for. And now we understand where their cancer came from. So yeah, those are just two things that I hear a lot. And I just, it frustrates me because I don't want people to have the wrong genetic information and use that inappropriately. So I'm like, no, we need to help. So I'm just hearing those.
Yeah. That's good to know, because honestly, if you're not educated, I would read something like that and I'd be like, oh, and then I'd go to the doctor and be like, hey, I want to test for this. And it's like, to your point, your doctor's just going to be like, here's your lab, go to it. And then they're going to be like, well, you're young, you're relatively healthy, blah, 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 blah. And then you're kind of just underneath the rug. Yeah, exactly.
Yeah. There's kind of this issue with like, either practitioners they order the wrong tests because it's just, there's genetics is confusing, and obviously we're trained for a reason. So I get it. Like, I don't know, certain specialties, but if the wrong test is ordered, that's a problem. But then other times I see practitioners saying, I don't want to order genetics because it confuses them. And so then they just don't order it for their patients. And I'm like, both, we need a kind of like that balance of just having a genetic counselor on board to help facilitate the testing. But, I think, I see misinterpretation all the time. Like, there's just a lot of issues with people ordering tests, not getting the accurate interpretation they need. So, I'm always trying to make it easier to receive referrals, send patients back with, information for not only themselves, but their provider, and so that we can still incorporate genetics in their plan.
Okay. So I have a completely kind of like off topic question, but my science brain is like going there. So I have to ask, with cancer, are you seeing more mutations in the cancer genes, or is it more of like an epigenetic factor or like a nutrigenomics factor that's driving these like, environmental rates, obviously another factor too, that are driving these cancer rates up? They were seeing like this huge increase in young people getting cancer. Yeah.
Yeah. It's such an interesting question. So I think it's confusing because we're using genetic testing more. And so we're seeing more people with genetic mutations for cancer, but it's hard to differentiate. And, like this happens a lot. It's hard to know if we're just getting better at finding it, or if it's because for some reason, I think, it's probably because we're getting better at finding it. I think it would be rarer. Like if we think about evolution, I think it would be rarer for people to have these mutations to be repopulating more. Like that's how we would increase it in a population. So my theory, this is personal opinion, but I would say we're finding the mutations more, but also environment is, I would say, the main primary contributor to why we're seeing increased rates of cancer. And that could be environment, could be anywhere from diet to also like toxins around us to lifestyle, being sedentary, all these things we're seeing that. And so with that, I always talk to my patients about like that to me means it's even more important to know your genetic risk and where you fall, because if we're seeing it more, then we should be we should really be aware of if you are in that high risk. And then I also actually talk about the environment with my cancer patients, which isn't always discussed, which I find silly because there's so much research about toxins in the environment, pesticides, poor diet, and lack of exercise, all contributing to cancer risk. So I always talk about with patients, like, how can we remove the toxins we know contribute to cancer? And then on top of that, how can we help your detox system? Because we can't run away from pollution and pesticides always. And then on top of that, how can we support your diet and lifestyle? And we can get really specific too. You know, there's research on sauna use, there's research on specific molecules. And so we get really specific with patients as long as they're not feeling information overload. But, you know, I think it's probably, I would say that contributing mostly.
So like if someone was at an increased risk, had poor detoxing skills, that'd be huge to know, right? Because then you can offer tips and tricks for them to, you know, kind of offset that in their life.
Yeah, exactly. I think that's why I love using nutrigenomics, because we can look at detox, oxidative stress, inflammation, and those indirectly can, you know, increase risk of cancer. And so I like to talk about both. I find it so interesting because though that information is so important, at the hospital, I had a family who had a mutation for cancer. All of them had it. And some of them got it. Some of them got cancer. Some of them didn't. They were all living on a farm, constantly exposed to pesticides as a child. And so it just shows how it's probably their detox system or other genes protecting them and contributing to that. So it's kind of something that's newer, I would say, in the world of genetics, is understanding other genes and how the other genes can also play a role in risk. It's kind of like polygenic risk scoring is just a term, but we kind of, I try to use as much information as I can to pull data from, you know, their genes and see where they're at.
That's fascinating. Okay. Also, let's say you have been diagnosed with infertility, undirect cause. Have you ever had like a client like that or a patient, and then you were able to kind of like figure out what it was?
Yeah. So I would say actually the genetic counselor who works in our practice specializes more in infertility. And then infertility it can get pretty complex because we kind of need to involve both partners. And so we can pull a lot from genetics. We can see, is there something in either of them individually? Is there something that happens when both of them come together, the egg and sperm? Because sometimes they look normal, they present normal, but they have basically one of their copies have an issue. And so when it's combined with, you know, either the sperm or the egg and meiosis happens, then there can be an issue and lead to miscarriage. So it's, you know, there's a lot of like complex factors. There's also in nutrigenomics, we can kind of pull some information with hormone balance, PCOS, endometriosis. So you can kind of, so a lot of times with like our infertility patients, we'll work together and look at, you know, multiple different factors. But I would say, you know, there's a lot of different components. There's actually a patient too, who her husband actually had something in his genetics that basically made it so that his sperm wasn't viable. And so they wouldn't have known that. And so there's a lot of information we can pull. Yeah.
Yeah. So cool.
I mean, those are some pretty good successful stories. I mean, do you have like a favorite success story off the top of your head that you can share?
You know, there's the patients who I love to see who will tell me, you know, with the nutrigenomics, because that's more trackable. A lot of the genetic testing we do is preventative, proactive. But there is a story that I can share, which this is kind of an extreme example. But I had a patient who ended up having an increased risk for ovarian cancer, and she decided to go in to remove her ovaries to be preventative. And while they were going to do the surgery, they found ovarian cancer at an early stage. And so, and ovarian cancer is oftentimes not caught early. It's usually caught late. Pancreatic and ovarian are often, can be a death sentence. Yeah. So she, you know, she was basically like genetic counseling saved my life. And so that's just, you know, a huge example of how knowing that information, you know, helped her find it early.
That's amazing.
Yeah. I really resonate with being scared, but I sometimes think we're so scared because we don't want to know, but really we do want the control. And it's kind of like that thing in your ear, like that's saying like, do it, do it, do it, do it. But like now that I've had this conversation, it's a no-brainer. I'm going to do it with you. But I would have had no idea genuinely that this was even a thing. I mean, I got genetic testing for my cholesterol when I was with cardiologists because we weren't sure what was going on with me. I ended up being panic disorder. Knock on wood, we'll find out if not. But they did say like I have a genetic cholesterol thing, and that's never going to go away. And cholesterol medication does not cure it. And that's something I am going to have to be very careful in the future. And I remember thinking to myself, like, it's not as scary now that I know that as when I was waiting for the test results. And now I know, okay, like maybe you don't have soup more than once a month. You know, like I started to make little changes when it comes to my sodium intake. And maybe you walk a little bit more. But I'm really excited to see and kind of go through the process with you because it's something that I feel like more women, to your point, need to do. Kimmy, have you done genetic testing? Or are you going to do it with me?
I want to do it.
Are we doing it together?
Yeah, we're doing it.
Oh my gosh, I'm so excited.
Do it for the pod.
Yeah.
I'm so excited. I'll compare your guys. No, I'm just kidding.
Yeah, I mean,
who sucks more?
Like, well, basically, you're screwed. Okay, so before we wrap, like, do you have anything to leave with the audience to just empower our mamas and our listeners to just consider genetic counseling and or information on how we can work with you?
Yeah, definitely. I think something that also just as a side note to moms, I think a lot of times it can be really helpful information for not only yourself, but for your children as well in the future, you know? And so I think it's something to keep in mind that it will impact your family and your future family. But on the flip side of that, that's what's important and empowering is because, you know, not only do you want to be there for your kids and also potential grandkids, but you also want to make sure, you know, you're helping them in every way you can. So I always think that, you know, it's something to consider and think about as well. Obviously, we always provide a supportive environment and talk about it before you even consider doing testing. But I would love, you know, if people had any questions, I would love to, you know, have people reach out to me directly. They can email me. My email is natalie@goldengeneticshealth.com, or you can follow me on Instagram. I have such a love-hate with my Instagram, but I love it because it connects me with people. And I love even people if they want to message me through there. It's Golden Genetics Health. You can also find out a lot more information about who we are, what we do on my website, which is goldengeneticshealth.com.
Great.
Well, we'll make sure that we have everything linked. It's really cool to see women in science for someone that's not. Like, it's really empowering for me to see young women, especially in these type of fields that are growing. And we're so happy that we got to partner with you to help spread the knowledge because these are things that are like newer, right? They're not in your everyday, like, you know, traditional medicine. So we really appreciate you coming on the podcast.
Yeah. Thank you so much. No, I appreciate you saying that too. Like you said, we need women to be confident and go into STEM if that's their passion. So I appreciate it. And I'm so happy I got to be here and spread the knowledge.
Yay. Thank you so much.
If you are loving the Mom Betch podcast, we really want your help to like, subscribe, and rate wherever you listen to your podcast so that we can get more Mom Betches to find us. But I have to give a shout out here for a second. Did you notice the quality of this podcast audio? That's because we have a podcast editor. Miraculously enhance your audio, get custom edits based on your preference, and let your podcast editor make the episode sound so much better with her audio content optimization. If you have a podcast or want one, talk to Taya, our podcast editor. She can help you strategize, edit, make social content, and keep you on track to make sure you have the very best show. AI can only do so much, so treat yourself and set up a free meeting with Taya to see how she can help you with your podcast. Go to tayachura.com/podcast. That's TEACHURA.com/podcast. Women
opportunity to empower women, and our voice matters.
Bitch.